Another thing that we really need to protect our bodies from is fluoride. Now, as a dentist, this is a tricky subject for me to talk about. Is fluoride a friend or a foe? Most dentists are going to tell you it's a friend, that it prevents tooth decay and that it strengthens teeth. Well, you know what? It's true. It does do exactly that. And the way dentists figured this out is because some people are on well water, and they started seeing that some people who drank exclusively well water had harder teeth. So they did some research to find out what's in that water that could be contributing to these harder teeth, stronger teeth, and they found it was higher fluoride levels. It does change the enamel crystal itself and make it harder and more brittle. Now, it's fine in a tooth because you have the softer dentin layer underneath to cushion things, but it also makes your bones harder and more brittle. That's not okay with a bone. And they found it through studies that in areas that have high fluoride levels, it leads to higher hip fracture levels. So fluoride's a problem with bones. Now, there's a cumulative effect that happens with fluoride as well. Let's take, for example, a child. Now, the parents are very conscientious for this child. As soon as that first tooth pops through, they're immediately cleaning that tooth with a washcloth, with a toothbrush, and using toothpaste that the baby likes, maybe some bubblegum flavored fluoridated toothpaste. Now, they take their baby to the doctor for a well baby visit, and the doctor recommends fluoride supplements. So they do everything that they are told to do for their baby. They go and get fluoride supplements. So now baby has fluoride supplements plus fluoride toothpaste. Well, as that baby gets a little older, maybe they want to try some of dad's fluoride mouth rinse. So they rinse with the fluoride mouth rinse because it's bubblegum flavored. It tastes great. Well, of course they're going to swallow a little bit, or some of it's going to go through their gum tissue. And then perhaps they live in a city that has fluoridated water. So every bottle that baby's been fed, every bit of food that baby's eaten that has any water in it has probably had fluoride in it. Do you think that baby really needs fluoride from all 4 of those sources to make their teeth stronger? How would you feel about it if the government decided that they wanted to put antidepressants in our water? Fluoride's the only thing that actually treats the person drinking the water, not the water itself. Think about it. Chlorine in the water treats the water, makes the water safer. Fluoride in the water treats the person drinking the water. Well, how would you feel about it if the government just decided that everybody in the country was a little too depressed and we needed some antidepressants added to our water? So, what happens if I'm already on antidepressants and I'm now overdosed because it's coming in my water? What happens if I don't need an antidepressant? I'm perfectly fine without an antidepressant, and now I've been medicated with something I don't need. What about my child who's getting the exact same dose of antidepressant in that water as I am as an adult, and they're much smaller than I am? This sounds really ridiculous when we put antidepressants in the water, but that's exactly what's happening when we're putting fluoride in the water. We're medicating everyone, whether they need it or not, and we might be over-medicating a lot of people. It causes other health issues. So what are some other sources? What are ways you can get water without having this problem? Well, first of all, water is the first place that you look. And I use a filter called a Berkey filter. You add an additional fluoride filter to that. That will filter the fluoride out of the water. That's a source of fluoride in your world. Dental fluoride is another source. So if you go to the dentist and they recommend dental fluoride, sometimes you need it because you have active decay. You use it for a short period of time. You don't use it over a lifetime. You just use it once when you need it, and that's it. Another source is dental products, and you know this. Toothpaste that have fluoride in it, mouthwashes that have fluoride in it. You can even get floss with fluoride anymore. Pesticides have fluoride release. Who knew that? Stain-resistant or waterproof fabrics release fluoride. In the air, in the soil, in the water and plants for manufacturing, all of these could be sources for fluoride in your environment. So do we need it in our water? Oh heavens no, we're getting it from so many other sources that we really can't control. Well, what is this fluoride associated with? It can lead to acne, it can lead to clogged arteries, it can inflame diabetes problems, it can lead to immune system issues, it can lead to ADHD, insomnia, fluorosis. This one has been known since the 1940s. What it is just too much fluoride that actually causes damage to the teeth. And this one's a big one. It can lead to thyroid dysfunction. The reason is that fluoride is, if you look on the periodic table, we're going back to high school science here, on the periodic table, it's in the halide category. So is iodine, bromine, chlorine, those are all in the same category, which means they are similar compounds. Well, iodine is what's necessary to activate thyroid hormone. It's called T3, it's triiodide. So it needs 3 iodine molecules in order to activate that thyroid hormone. Well, fluoride mimics iodine, and fluoride is a bully. So if you have fluoride in your system, it will push iodine out of your system, and it will actually bind to the thyroid hormone instead, which creates what looks like an activated thyroid hormone, but it's not usable by your body. So on a thyroid test, you show normal, you test normal, but you think, but I have all the symptoms of thyroid issues. It's probably because that thyroid hormone has been activated by fluoride rather than iodine, and it's not usable by you. This is a big deal. How many people do you know of that have thyroid problems? So we're all being medicated. It's through our water, our food, our environment, our medications, the synthetic fabrics, through all of these things. Please protect yourself from fluoride. Avoid it through water filtration, through dental products without fluoride in them, and just avoiding it as often as you can. So these are 2 things that I really wanted you to be aware of on how dental health really does impact overall health and how you can reverse a lot of your overall health conditions by addressing your dental health. So if you have any questions about tooth health, about what I've discussed here, feel free to ask them in the comment section below. If you found this information helpful, please give the video a like and make sure to subscribe to our channel for more health and wellness related content, and make sure to tap that bell. Thank you so much for watching. Let's live well together.